All right, today my guest is John Burke, and I'm going to ask him to share his background with us. But before I do that, I want to tell you how I first met John. I met him probably about, I think, 8 or 9 years ago at a National Association of Drug Diversion Investigators conference. John was part of the team putting together the conference, and his team members graciously included me the first evening when they went out for a meal. And so I had a wonderful time getting to know John and his team and some of the people involved in leadership in that organization at the time. So John, please give us some insight on your background and what led you to get involved with drug diversion prevention.
Well, thanks, Terri. Thanks for having me here. And I do remember that meal. So we had a good time. I've been in law enforcement, or I was in law enforcement 49 years. The first 32 years was with the Cincinnati Police Department, and I came out of internal affairs and I got into a thing called pharmaceutical diversion. And not in 1990, not many people knew what that was, but I got into it ended up with 6 investigators and a secretary and myself. And one of the things that was unusual in this, we had one guy that we hired actually who had a little bit of experience. Nobody else in law enforcement, for the most part in the country, had much experience in it. And he had experience in some institutional diversion, some hospital nursing home diversion. Not much, but he had had a couple cases, and we were very fortunate. What made this was the Ohio Board of Pharmacy at that time had 12 pharmacists, all of which had hospital pharmacy experience. And their job was to investigate the theft of controlled substances from nursing homes and hospitals. So fortunately, we were able to grab them, and because you can imagine, I mean, we're a bunch of cops, and the only time we've been in a nursing home or a hospital is when we visited somebody, right? So it's a whole new realm, all different regulations, different laws, but thank goodness for the Ohio Board of Pharmacy and these pharmacists, because they made all the difference. I don't know if we could have done what we did without them. And they introduced us, they schooled us, and my investigators, it takes about a year really to get halfway decent at it. And so thank goodness for them. They got us involved in this big time. And then, one of the reasons that I wanted to get involved in this, and I still think today, is there's victims here. And, the first victim is, of course, the potential patient. And then there's another victim, which is the person who's addicted. And as you know, this is virtually 100% addiction. This is not trafficking. This is not, hey, I want to do this so I can, I'm going on vacation, I want to take some. No, it's addiction. And so you have those two folks that need help, and they're very much in danger. Either one, frankly, could pass away from this problem, and especially the person who's addicted. So that's how we got involved in it, and that's, I guess, why I took such an interest in it. And we were eventually able to work our way into the health facilities. We had one holdout, which we almost locked up the head of the security department, and he finally got on board. And the people from the pharmacy board, you can imagine, had big impact on the officers and pharmacists in the facilities. So they helped us big time. And then the nursing homes, we had 2 or 3 large pharmacies that did nothing but do nursing homes, and we got those people involved. And we had a couple ladies that were very good detectives. So that was our thing. We stayed very busy. We ended up arresting about a nurse a week for several years, and so that's how we got involved in it. And I think it's every bit as important today as it was in 1990.
Absolutely, I agree with you. And that collaboration between the investigator, law enforcement piece and the pharmacy piece is essential. We each bring something different to the table, right? Our background is different. Excuse me. And from a pharmacy perspective, we've got the medication pathway piece of it, which the law enforcement doesn't know, but then we don't necessarily have the investigative piece of it. So it works really well together. So that's great. You were maybe a little bit ahead of your time, or at least in your city. And I think that's fantastic. And where it has grown today, because you're right, it's an important piece of keeping really the victim safe, right? The healthcare worker. We sometimes forget about that. We think about the patient, but we forget about the healthcare worker.
Exactly.
So at the time that I met you, you were involved with NATI, but now you have another organization that you're president and co-founder of. So tell us about that.
Yes, I think in 2015, myself and Kim New and Denny Lucan and a couple others broke off to start the International Health Facility Diversion Association. So it's an organization, nonprofit, that's dedicated totally to the diversion of either nursing homes or hospitals. And so it's very specific, smaller number of people. I wouldn't say more diverse. I mean, the majority of them are probably health professionals, pharmacists, and nursing managers, but there's HR and there's other folks, and there's some law enforcement and healthcare security folks that are also part of that. So we're pretty excited about that. Unfortunately, we didn't have our 5th annual conference because of COVID, but we're hoping to have our 5th one here in September in Chicago.
Okay. What types of things do you offer your membership?
Well, we have, number one thing we have a listserv, which I thought through NATI can be very valuable. So anybody can come on and ask a question of the hundreds of people that are on the listserv. Or some people just stalk it. Some people just like to look and see what's going on, and that's okay too. But then others will get on, and then they'll have maybe a complicated question or maybe something that's more confidential, and so they'll take it offline, off the listserv at least. And so they have so it's a networking opportunity. We also have a pretty good library of diversion videos. We have past conferences. We took the folks that were supposed to speak in Chicago in 2020, and we've made monthly webinars out of them with CEs. And so if you're a member, you can get in and get that. And then of course we have had a few regional conferences. We would have had some this year too, but probably going to wait another year. And those have been all across the country where we invite people to come in and and see them face to face. So we provide that, and I think that probably the other thing that we provide is in addition to the listserv, the networking of being able, so they can access people that are members and call them, can email them, whatever the person's provided, and I think that it's as the problems in California are the same in Michigan and in Ohio and in wherever. I mean, people, sometimes we begin to think, oh, we're so unique. Well, we're really not. I found that out in law enforcement too. So by calling and being able, two people that have like jobs in totally different venues, the ability to help. Well, one of the things is I think we see a lot is people wanting to say set up a diversion, either I'll call it like a diversion specialist along with maybe a team that responds. And they'll be looking for somebody else's, to plagiarize somebody else's. I've never, in this business and law enforcement, plagiarism is not a bad word. It's just taking something somebody's already done. So they have the ability to do that. And I think that is a big plus for them too.
Yeah, I agree. And I will echo that. I have, with the listserv, I have probably done all 3 of those things. I have stalked, I have participated, and I have taken it offline as well. And, good point with the CE availability for that, since the conference had to be canceled in person, but those people that have done the thing, so that's a great avenue for it. And I will add that the networking is invaluable, because you're right, when it comes to the plagiarism, there's no point in starting from the beginning. And for those of us that have been in it for a while, we've learned our lessons, and we can help you bypass that if you're new and you can learn it. So I think that one of the biggest benefits for me has been definitely the networking and learning from those that are experienced, because there's a lot of people that attend and are involved that have a lot of experience. And then you bring your newbies on board, and that's where the value is from them. And I'm going to add too that the cost of joining this group is extremely reasonable, especially if you consider the fact that it includes attendance at the conference. So the conference price is very inexpensive and very reasonable, but then you get the whole annual membership for that. So for those of you that are not familiar with IHFDA, do check it out, because they do have a lot of resources. John, do you have a specific example perhaps of how membership in the group or attendance at a conference made a real difference for somebody, if either individually or as part of for their facility?
Yeah, and I won't get into naming them, but I can give you a specific example. we've had groups come. The University of Michigan is the one I'm thinking most prominently, who came, who had issues and who got fined by the DEA, I don't know, a couple, $3 million. And there were people, and they gave their story and then what they did. And most of these places are not trying, these are not deliberate things. These are things that, technicalities that fall, and that's what happened with them. Well, I guess what I learned was there were a couple different people from 2 different organizations who, listening to their talk and then being able to network with them after the talk, I think they feel like they avoided a bigger problem than they might have had. So, listening to how these things work and what to avoid, and because that's what those people are there for. They're trying to do the right thing, but as you know, these things are not always black and white. And trying and learning from a facility who had gone through all this, the impression I got was they felt that they went back and corrected things and got things on board that maybe kept them from a multi-million-dollar fine. So that was probably one of the biggest.
Yeah, and that's a good example of the people that are there and the people that are networking in this group. We are not competing with each other, and they are very forthright in lessons learned and what they did wrong, right? Not intentionally necessarily, but realize that, oh my goodness, we didn't have that under control. And so you really do learn the things that your pages of notes, and you go back, oh, let me check and make sure we're doing that or we're not doing that, right? So yeah, very, very insightful. So I'm curious if you have, we've got the whole COVID pandemic that has been going on this whole year. Do you have any perspective on controlled substance use and monitoring during the COVID pandemic? Any thoughts on that?
Yeah, I don't think it's particularly good. I mean, I had this problem. I'll just give you an example. When we started the pharmaceutical diversion squad at the Cincinnati Police Department, they were always looking to cut people, and if I didn't keep us in the front and center all the time, and after I left they did do away with the unit, then it seemed like we were always on the chopping block. I think that some of that is similar in health facilities. Not maybe that the health facility doesn't think that diversion is important, but COVID, let's face it, came to the forefront, and it was everybody. And I think there's been a certain amount of, hey, all hands on deck. I know what you were doing, but we need you to come over here. And maybe it was thought of to only be a few weeks, but it's probably still going on. And what happens is in those situations is that, diversion doesn't stop. It's not like that, oh my gosh, COVID's here, so we're going to stop stealing drugs. And I think that in actuality, it may increase it because of the stress. If you were, let's say, somebody on the bubble, and COVID comes in, and all the things that go with the work that you all do in the hospitals to try and save people's lives, I can see that being even a bigger problem. And I would guess that maybe even some signs that somebody might see of diversion, they may have been, say, overlooked or maybe passed over because, hey, we're just so busy. And I know health professionals, at least back in the strong time, they were working incredible shifts and practically needed to be there 24 hours a day. So I think with the lack of attention had to go away from diversion. And when that happens, I'm afraid it ramps things up. So I would hope that those folks, once you get back to normal, whatever normal is, that you vigorously start your diversion program back up, because I think you're going to find you've got some issues.
Yeah, I completely agree with you. Everything had to be switched to the focus, right? Is just having enough staff and handling these patients and all of the things that go into, pediatric hospitals that I heard were turning into adult hospitals because they needed more space, and segregating your hospital into your COVID unit and just so much going on. And then not to mention, a lot of the states were taking nurses and other staff from out of state, right? So those are where you could maybe have some problems with people that already have an addiction problem and now slide into a system very easily that wouldn't normally have gone in that direction. So you're right, that there's a lot with that. How about outside of the COVID pandemic? Are there any areas that you feel are particularly susceptible to diversion that you find are often overlooked in facilities?
I think the one that's overlooked and it's difficult is the long-term care / nursing homes. I think they always have been. The problem with, as you know, they may be owned by multiple owners. They may be out of town owners. They aren't necessarily people that are in town. You then have a situation where, as far as the amount of workers, and you go on a night shift in a nursing home, you may be down to one nurse. There may be some other folks there, and diversion becomes much easier in those circumstances. So I always think that, I mean, there's plenty in the hospitals, but I don't think we have a real clue on what goes on in nursing homes and long-term care facilities. I really don't.
Yeah, you're right. And I think, unfortunately, what also might be missed there is if they don't view the resident as a good historian, then nobody listens, right? I think there's a problem. And in fact, a friend not too long ago reached out to me because she was convinced that they were stealing from her father's supply, but you've got to work on that historian part of it. And, believe me that there's something going on. So yeah, no, I agree with you.
They tend to gravitate to those folks that can't tell you whether they got their
Yep, exactly.
So that creates another issue. Yeah.
Yeah, no, definitely. I agree with you. So what is the favorite part about the work that you're doing currently?
Well, my favorite part, I think I would have to say, is still feeling like we're making a difference. Now, it's not near enough, but it's a lot more than when I started. And I love working with the people at IHFDA, people like you who understand and are doing everything they can to prevent it or deal with it. And so, whenever I hear about, we had a lot of these in Cincinnati where these nurses were put into drug court, we called it. And that was a very intense program. And 70% of them, Terry, were successful. And if you know anything about addiction or anybody out there, 70% is an enormous success rate. And some of the officers got embarrassed. They would go to their graduation and they ended up getting hugs and stuff. So seeing those people having another lease on life that avoided probably overdosing and dying, I mean, those are huge things to me. And I enjoy, we had a lady a few years ago who was an addict and had her problems, and she came on, and I kind of follow her on Facebook, and she's doing really, really well. So she's not back in nursing, and that's the thing. You may not be able to get back in nursing, but number one is you got your life, and you've got a child, and so I think that's the most satisfying thing, is thinking that, and I know sometimes people think we're harsh because we're law enforcement, but truly in this situation, we're trying to save a life, and we just, how we deal with it is, may disagree on how we deal with it, but I think law enforcement I saw it work as an integral part of this is saving people. So yeah, that's the most satisfying.
Yeah, making a difference. No, that you're right. That's what it's all about, right? Mm-hmm. All right, before we wrap it up, is there anything additional you would like to share about yourself or the work that you do, or do you want to turn the tables and ask me a question?
Oh, wow. I'm trying to think. I'm old, as you can tell. But when you say you've been in law enforcement almost 50 years, you got to be old, right? I didn't start.
Got to be old. I know.
No, I think you've covered everything pretty well. I appreciate the opportunity to chat with you, because it's you're a great human being, and you're one of those people that you're not the one that's searching necessarily. You're helping these people that are new, giving them information, and we really appreciate that. That's pretty cool.
Well, thank you for collaborating with us healthcare professionals, and bringing another perspective to it, and giving us a venue to share and to learn and to grow. We really appreciate that.
Thank you.
Okay. Thank you very much for your time today, John.
Okay. Thank you.